Hello everyone, and welcome back to our channel. Today we're going to talk about a rare but important condition called acromegaly. You might have heard of it, but what exactly is it? Stick around as we break it down, covering everything from what it is to how it's managed. So, what is acromegaly? In simple terms, it's a hormonal disorder that happens when your pituitary gland produces too much growth hormone during adulthood. This gland, a tiny pea-sized organ at the base of your brain, is the master conductor of your body's hormones. When it produces excess growth hormone, your bones increase in size. This includes the bones in your hands, feet, and face. Acromegaly usually affects middle-aged adults and can go unnoticed for years, as the changes happen very slowly over time. If this overproduction of growth hormone happens in childhood, before the growth plates in the bones have fused, it results in a condition called gigantism, where the child grows to an extraordinary height. But in adults, since the long bones can't get longer, they get thicker and wider. Now let's talk about the symptoms. One of the most common signs of acromegaly is the enlargement of your hands and feet. You might notice your rings don't fit anymore, or you need to buy bigger shoes. But the changes aren't just limited to your limbs. Facial features can also change gradually. You might see a protruding lower jaw and brow, an enlarged nose, thickened lips, and wider spacing between your teeth. Your voice might become deeper and more husky due to the enlargement of your vocal cords and sinuses. Beyond these physical changes, there are other symptoms to be aware of. People with acromegaly often experience severe snoring and may develop sleep apnea, where breathing repeatedly stops and starts during sleep. This is because the excess tissue can block the airway. You might also notice thick, oily skin and increased sweating and body odor. Numbness or tingling in the hands and fingers, a condition known as carpal tunnel syndrome, is also common due to tissue swelling pressing on the nerves. Many people also experience joint pain, limited joint movement, and fatigue or muscle weakness. For women, it can cause irregular menstrual cycles, and for men, it can lead to erectile dysfunction. Some people also get frequent headaches and may have vision problems. Because these symptoms develop so slowly, sometimes over many years, it's easy to dismiss them as just normal signs of aging. This brings us to a crucial point. When should you see a doctor? If you notice any of these signs and symptoms, especially a combination of them, it's important to make an appointment with your healthcare provider. Acromegaly is a condition where early diagnosis and treatment are key to preventing serious complications. Don't hesitate to bring up your concerns, even if the changes seem minor or have been happening for a long time. Your doctor can help determine the cause and guide you toward the right specialists. So, what causes this overproduction of growth hormone? The vast majority of acromegaly cases, over 95%, are caused by a non-cancerous or benign tumor on the pituitary gland. This tumor is called a pituitary adenoma. The tumor itself secretes the excess growth hormone, leading to the symptoms we've discussed. As the tumor grows, it can also press on the surrounding brain tissues, which can cause those headaches and vision problems I mentioned earlier. In very rare cases, acromegaly can be caused by tumors in other parts of the body, like the lungs, pancreas, or adrenal glands, that produce either growth hormone themselves or a hormone called growth hormone-releasing hormone, GHRH, which tells the pituitary to make more growth hormone. If left untreated, acromegaly can lead to some serious health complications. The overproduction of growth hormone affects the entire body. It can lead to high blood pressure, high cholesterol, and cardiovascular problems, including an enlarged heart. It also significantly increases the risk of developing type 2 diabetes because growth hormone interferes with the action of insulin. There's also a higher risk of developing polyps in the colon, which can potentially become cancerous if not removed. Arthritis is another common complication due to the changes in bone and cartilage. As we mentioned, sleep apnea can be a major issue, disrupting sleep and affecting your overall health. And vision loss can occur if the pituitary tumor presses on the optic nerves. This is why getting diagnosed and treated is so incredibly important. Are there any specific risk factors? For the most part, acromegaly isn't inherited and isn't something you can prevent. It's usually caused by that spontaneous pituitary tumor. However, there are a few very rare genetic conditions that can increase the risk of developing these tumors, such as multiple endocrine neoplasia, type 1, men 1. But for the average person, there's no specific lifestyle factor that makes you more or less likely to develop acromegaly. It's a random and rare occurrence. Let's move on to diagnosis. If your doctor suspects acromegaly based on your symptoms and physical changes, they'll order some specific tests. The first step is usually a blood test to measure the levels of growth hormone and another hormone called insulin-like growth factor. So, what are the treatment options? The main goals of treatment are to lower your growth hormone levels back to normal, relieve the pressure that the tumor might be exerting on the brain, manage the symptoms, and address any complications. The primary treatment is often surgery to remove the pituitary tumor. This is typically done through the nose and sinuses, a procedure called transsphenoidal surgery. When performed by an experienced neurosurgeon, this can be very effective, especially for smaller tumors. If surgery doesn't completely remove the tumor or isn't an option, medication is the next step. There are several types of drugs that can help lower growth hormone levels and shrink the tumor. These can include somatostatin analogs, which reduce growth hormone production, dopamine agonists, and growth hormone receptor antagonists. In some cases, if surgery and medication aren't fully effective, radiation therapy may be used to shrink the tumor and reduce growth hormone levels over time. What about alternative medicine? While there are no alternative therapies that can treat the underlying cause of acromegaly, the tumor, some can help manage symptoms. For example, practices like acupuncture or massage might help with joint pain. However, it's absolutely critical to remember that these are complementary therapies, not replacements for medical treatment. Always talk to your doctor before starting any alternative treatments to make sure they are safe and won't interfere with your prescribed medical care. Finally, let's discuss lifestyle and home remedies. Living with a chronic condition like acromegaly requires ongoing management. A healthy lifestyle is a huge part of this. Regular exercise, as cleared by your doctor, can help improve your strength, energy levels, and joint mobility. A balanced diet is also essential, especially for managing potential complications like diabetes and heart disease. Getting enough sleep is crucial, and if you have sleep apnea, using a CPAP machine as prescribed is vital for your health. Perhaps most importantly, find a good support system. Connecting with others who have acromegaly through support groups, either online or in person, can be incredibly helpful. Sharing experiences and advice with people who truly understand what you're going through can make a world of difference in your emotional well-being. Acromegaly is a complex condition, but with proper diagnosis and a comprehensive treatment plan, people can live full and healthy lives. The key is to be aware of the signs and to seek medical help if you have any concerns. Thank you so much for joining me today to learn about acromegaly. I hope this information was helpful and empowering. If you found this video valuable, please give it a thumbs up, and don't forget to subscribe to our channel for more health content. As always, take care of yourselves, and we'll see you in the next video.